Building Block 5, the Patient-Team Partnership. Health Coaching Strategies for Engaging Patients in Care. Building Block 5 in the 10 building blocks of high-performing primary care is the Patient-Team Partnership. An effective patient-team partnership recognizes the expertise that patients bring to the medical encounter, as well as the evidence base and medical judgment of the clinician and team. Instead of being told what to do, patients are engaged as active partners in a decision-making process that respects their personal goals and capabilities. In this presentation, we'll learn two key health coaching skills for engaging patients in their care. Let's first explore what health coaching means and why it matters. Did you know that half of patients leave medical visits without understanding the provider's advice? Research has furthermore shown that in only 10% of visits are patients involved in the decision-making process. The majority of patients do not follow the provider's advice for two reasons. First, the provider was not clear and the patient did not understand what the provider said. And second, the patient was never asked to give an opinion about the care plan and doesn't agree with the provider. For these reasons, a large number of provider visits are not helpful to the patient. They are wasted visits for the care team and patient alike. Health coaching solves many of the problems with wasted visits. It can eliminate unnecessary and frequent visits while transforming visits into useful encounters with the healthcare team. Health coaching assists patients to gain the knowledge, skills, and confidence to become informed, active participants in their health care. The purpose of health coaching is to help patients understand the care team's advice, discuss how patients feel about that advice, and work with patients to use that advice to improve their health. Research shows that health coaching can improve disease control, medication adherence, and the patient experience. Indeed, health coaching helps both the patients and the care team. For patients, it can lead to better health outcomes and more satisfaction with their healthcare experience. For care teams, coaching can distribute responsibilities among team members. Health coaching is often provided by non-provider team members since providers are busy making diagnoses and prescribing medications. When care team members like medical assistants, nurses, health educators, or pharmacists act as health coaches, they are usually given protected time to assume this time-consuming function. However, all members of the care team, including clinicians, can use health coaching skills in every patient encounter. Unsurprisingly, patients who collaborate in making their own care are more likely to adhere to the care plan. To foster our patients' active participation, care team members can use the health coaching skill Ask, Tell, Ask. Ask, Tell, Ask is a three-step method for balancing questions that allow us to learn more about our patients with opportunities for sharing information that our patients need to know. If we want patients to participate in their own care, which we do, then we have to ask questions. Asking helps reveal obstacles patients encounter when trying to improve their health. Why is that patient not active? What are the difficulties with taking medications? If we don't ask, we can't identify the barriers our patients are struggling to overcome. In addition to learning about our patients' barriers and challenges, we ask questions to find out what our patients feel and think about their health, are ready or not ready to do about their health, know and want to know about their health. The 3 steps to Ask, Tell, Ask are as follows. Ask, Begin with an open-ended question to learn more about the patient perspective and knowledge. Tell. Provide information based on the patient's initial response. Ask. Follow up with another open-ended question or close the loop. Ask the patient to teach back the information covered. We begin by asking our patients an open-ended question. As you can imagine, the closed-ended questions we often use in healthcare tend to result in one-word yes or no responses. To avoid these one-word responses, it's important to focus on asking open-ended questions when using the ask-tell-ask approach. For example, rather than asking our patients, "Are you taking your medications?" we can reword the question to make it open-ended by asking, "How are you taking your medications?" Alternatively, the first step in ask-tell-ask can be used to ask our patient for permission to discuss a particular topic. For example, "May we take a moment to discuss your medications?" If our patient needs more information, we proceed to the second step. Tell. We tell after we ask in order to tailor the information we provide to our patient's current level of understanding and needs. After completing the telling step, we follow up with another question to either continue the conversation or to confirm that the information we previously provided was clear by asking our patients to teach back the information we provided. The following is a sample dialogue using the ask-tell-ask approach. How would you feel about us taking 2 minutes to go over your A1C test result before you leave?
Sure, that's fine.
Great, thank you. Before we jump into your A1C test result, what can you tell me about the A1C?
Not much. I think you said something about it measuring the level of sugar in my blood.
That's right. The A1C test measures the average level of your blood sugar over 3 months. I have a chart of your results from the past year. You can see how you've been doing from the blue line.
Looks like it's been going up. I'm a 10 now, is that right?
Yes, that's right. What do you think you were doing differently back in August when you were at 8? By asking the patient questions about her understanding of the A1C test and previous experiences, the provider in the previous scenario created an opportunity to gain insight into her patient's knowledge and readiness for change. Let's now explore our second health coaching skill. Research has shown that patients remember and understand as little as 50% of what the provider says. In the healthcare setting, many of our patients are unfamiliar with words like hydrochlorothiazide and LDL cholesterol. What's more, we often combine this jargon with additional information like instructions on increasing the dose of a medication. For a patient, these details, directions, and terminology can be both confusing and overwhelming, especially when compressed into a 15-minute visit. The consequences of poor recall can be tragic for patients. Take, for instance, a patient with uncontrolled hypertension. The provider adds a new medication and adjusts dosage of current medications. The patient does not understand how to take the medications. The patient decides to take one of each medication 3 times a day because he recalls the provider saying something about 3 medications. The patient takes too many medications. His blood pressure drops too low, and the patient almost dies. When we tell patients information, how do we know they've understood? A method to assess patient understanding involves asking patients to state the physician's recommendations in their own words. This is called closing the loop or teach back. Physicians' use of teach back for patients with diabetes has been associated with better glycemic control compared with physicians who do not check patients' understanding. Health coaching trainings and health coaching sessions with patients include Ask Tell Ask and Closing the Loop, in part due to elements of adult learning theory. Each of us has different learning styles, and we learn more if we are more engaged and activated. Adult learning theory shows that we retain only 20% of what we hear, but up to 70% of what we say, and 90% of what we say and do. The 3 steps to closing the loop are as follows. Start the conversation by asking the patient what they understood about the information covered. Tell the information when the patient doesn't know. Ask the patient to summarize in their own words the information covered. Repeat asking and telling as needed until the patient is able to summarize the information correctly. There are certain situations when it's particularly important to close the loop on the information covered. These situations include when patients have changes in care plans, changes in medications, new diagnoses. In addition, it's important to close the loop on information covered in situations when patients need to obtain labs, especially if off-site, complete screening tests, follow up with specialists. Let's see an example of a conversation using closing the loop health coaching technique. Before you leave, I'd like to review your new diabetes medication one last time. Is that okay?
That sounds good. Thank you.
Great. What do you remember about how to take the medication?
Honestly, not much. We went over a lot of stuff.
We did cover a lot, so let's take a quick minute to review. The name of your new medication is metformin, and I'd like you to take 1 pill twice a day, after breakfast and dinner. If you have trouble with your stomach, cut down to once a day.
Okay.
Again, I know that's a lot of information to take in. I want to make sure I did a decent job explaining everything. Starting tomorrow, how will you be taking this new medication?
I'll be taking 1 pill twice a day, after breakfast and after dinner.
Nice. And what will you do if you experience any problems with your stomach?
Oh, that's right. I almost forgot. I'll go down to once a day if I feel stomach problems.
By taking the time to assess the patient's understanding of her new medication, the provider in the previous scenario was able to confirm the patient's knowledge, address potential misunderstandings, and consequently prevent a wasted visit. A participatory relationship between patient and care team is one of the most decisive factors in promoting healthy behaviors. Active participation by patients, achieved by asking them about their motivators, preferences, barriers, and goals, is associated with better outcomes than telling patients what to do, which makes them passive bystanders in their care. Using a health coaching approach to our patient care allows us to strengthen the patient-team partnership. Ultimately, this yields an enriched experience for both our practice and our patients.